birthday or his last name for us.
And how long has that been going on?
Daughter said for a couple weeks she's noticed some forgetfulness and some confusion about who she is.
Okay, and they think he fell 2 days ago?
She went out of town with her husband, and she came home and there was dried blood all around the house and a pool by the table, which is why they suspect he hit the table.
Okay.
And he was laying on the couch with a beat up forehead.
Okay. Any medications that he's on?
Yes, he's on 20 milligrams Lasix daily, atenolol 25 milligrams, PO daily, Dig 0.125 milligrams daily, Nalopril 2.5, Coumadin 2 times 2.5.
What do you mean 2 times?
2 tablets.
I just had 2.5.
Oh, okay.
That's something we can clarify.
2.5, so 2.5 of Coumadin, and did he have labs run in the ER? Anything
Yeah.
abnormal there?
His PT and INR were both low. His bun and creatinine were.
What was his?
Oh, sorry.
Tell me the
PT was 1.8. INR was 1.0.
Oh, okay. He's on.
Bun
Yeah.
54, creat 1.8, Dig was a little elevated at 2.2.
Okay, and I stopped by radiology and they told me about his CAT scan and that looks good. So, okay, well, I'm pretty sure he can, I mean, there's no reason really for him to stay. So, I'll go in and talk to the family and do a little neuro exam and, set up an appointment for him to see me in the office.
Okay,
Probably in about a week.
do you want to do any sort of fluids because they are unsure if he had anything to eat or drink over the last 2 days since they've
Sure,
been
we
gone?
can give him before he goes, let's give him a liter of 0.9.
Okay.
Over, I don't know, 2 hours, I guess would be
Okay.
fine.
Okay.
Okay, and then let's consult discharge planning for him.
Okay.
Okay?
Okay.
Okay, so I go in and I do an exam. I find like the same thing. He's a poor historian, alert and orientated, disorientated to time, a little bit questionable on place. As far as motor function, he seems to be equal bilaterally, both in upper and lower extremities. All of his cranial nerves are intact, and yeah, so we can have discharge planning come in and see the patient.
Okay.
Okay, discharge planners, you can come in.
How you doing, Dad? Okay?
Yeah, I feel better.
You feel
Good.
better? Do you guys have any questions while we're waiting for discharge? No?
The doctor sounded like everything was okay, but they mentioned something about like a trophy. Is he
Oh.
getting a trophy or what? What was that about?
Atrophy?
Yeah. Yeah. I guess
Well,
we
she
can.
she knows about it.
Yeah.
I didn't get I
Yeah.
wasn't listening when she called, so I don't.
We can definitely, if you're still confused about it and want to know more, we can definitely have the doctor come in and
Okay.
explain more.
Yes, I'd like that.
Yeah.
Thank you.
So,
Okay. Discharge planning probably needs some report,
yep.
yes, since we don't have a computer for you to look at.
Okay. So, Mr. Whitehorse, these are your new nurses, Joanne and Katie. They're gonna be taking care of you for till you're on your way home. Okay.
Alright.
And this is Donna, this is his daughter, she's been with him the whole time. And he lives with her at home, her and her husband. He's an 86-year-old, fell 2 days ago, ER wanted to admit him just to check him over and keep him for some observation. He has an laceration on his right head and a bruise on his right leg from the fall. He has some confusion and forgetfulness, and that's been going on for a couple of weeks, so he was a little unsure of what exactly happened. Daughter and husband were out of town for a couple days, so that when they came home, they weren't really sure what happened either. So they suspect he hit his head on a table. He has a history of AFib. He does drink 3 to 4 beers a day, and they suspect that might have had something to do with the fall. And he is a smoker. He has allergies to Procardia.
And family would like to talk to a physician too before they leave because they're a little confused about some of the things they talked about. He does have normal saline going into his right hand
IV.
and and then we did give him morphine 10 minutes ago, but that's every 2 hours, but his pain's under control.
Did the doctor mention what medications he's going to be discharged on?
That they haven't talked about. Or
No.
we're not unsure if the family knows as well. So
Okay. And did he have a discharge order in place yet?
She did say that we should get discharge planning involved, so I'm guessing she wrote an order.
Okay.
Yes, there is an order for discharge.
Okay.
Discharge following visit by discharge plan.
Okay.
Okay.
any other questions for us?
I do not.
Vital signs are good. Okay. Let us know if you need
Okay,
anything.
call if you have a question.
Okay.
Thanks. Good luck with everything, Mr. Whitehorse. We'll
Thank
see you later.
Thank you.
So would we be able to call the doctor, okay, 'cause I would think we'd wanna call the doctor and find out what medications.
Okay,
he
give me a
can
call. Give the
Okay.
doctor a call. Hi, this is Dr. Steele. How can I help you?
Hi, this is Joanne. I'm a nurse on the med-surg unit. I'm here with Michael Whitehorse in room 409.
Mm-hmm.
And he had been admitted for a fall, which was estimated to be 2 days ago. And he now has discharge instructions in place. So I was just trying to follow up on medications and what type of follow-up visits he would need in place.
Okay, yep, he can continue on his home meds, and I would like to see him in my office in a week.
Are you the neurologist?
I'm the neurologist.
Okay.
Yes.
In a week, you said?
Yes.
Okay, and is there anything that needs to be changed? Anything else that needs changed that you know of from his previous, from before he came in before? Like, is he needing like special fall precautions at home or anything of that nature that we need to know
Well, you
about?
can put those things in order as far as being the discharge planner. If you do an assessment and find that he needs any of those things, please get that arranged.
Okay.
Okay, let me know what you need for orders after you do your assessment.
Okay, any wound care follow-up?
No, actually, it was clean, dry, and intact. It should heal well on its own.
Okay. All right.
Okay?
Okay.
Any other questions? Okay, great. Have a nice day.
Hi, Mr. Whitehorse. I'm Katie.
And Katie,
This is Joanne.
Hi. I'm a nurse that's helping discharge you. So you'll be leaving the hospital today.
your name is Joanne.
Joanne, yes.
Like now?
Yep.
You can't come home now.
Were you concerned about how he would be able to be at home?
My husband Tom and I, we work. I can't leave him alone anymore. I just found him after 2 days. I'm not gonna feel comfortable leaving him again.
Okay, we can have our care management team come in too to talk about the possibility of something like a home health visit or different things like that, so we can go over the big picture. Because if you're not feeling comfortable with him at home, we should probably discuss different options.
Okay, so as a discharge planner, you are the care management team.
Okay.
That's who you are.
Okay. What are your concerns?
Well, Dad, I don't think you're gonna be giving up your drinking or smoking anytime soon, right?
No, I like to drink.
So I can't stop you. That's your prerogative at your age. But
So,
Would
I
you
have
be-
to work, and Tom can't stay home with you either. So we gotta figure something else out. I want you to stay living with us. I don't want you in a home.
Would
I
you
know.
be willing to talk to somebody about the drinking and smoking?
Sure,
You would? Okay.
yeah.
So that's something we can also do.
Okay.
We can have someone from the hospital come up before we discharge to talk about that. Would you be okay with your daughter being present for that?
No, that'd be fine.
Okay. And you're okay with being there for that too?
Yes. Can they get him started on like a patch or something for his nicotine, so maybe he wouldn't burn the house down again?
Would you be willing to be on a patch instead of smoking? Have you tried that before?
No, I haven't.
Okay. Would you consider that maybe?
Well, if somebody explains that.
Okay.
Yeah.
The way it works, just to give you a little bit of it, it's a patch that you place on your arm, and it's a once daily thing. It kind of cuts down on the desire to smoke, but it's not a fix-all thing. And also, if you smoke while you're on the patch, it might make you feel sick.
I see.
Okay.
Mm-hmm.
So are you thinking you want someone to come to the home to be with him during the day?
Yes, please.
Okay. Okay.
And we can reach out to the insurance company too and see if that would be something that would be covered under his insurance. What kind of insurance are you currently on?
Well, I'm on Medicare.
Okay. Have you had a fall before this at home?
I don't quite remember, but maybe I did.
Okay.
Did I? I don't remember.
Only if you tell me, Dad. I don't know. You've been pretty good on your own up until just like 2 weeks or so. Then something's been changing.
Okay. So, we should probably reach out to your insurance before we discuss the exact options of what we could have for a home health situation. And you aren't wanting to consider something like a skilled nursing facility or nursing home?
No.
Okay.
He's staying with us.
Okay. So we'll have to reach out to insurance first. As for medications for when you do go home, you'll be on the same medications as before.
All right.
So we could kind of go
Okay.
through that list too. Did you have any questions about the medications? Did they?
My daughter usually sets it up for me.
Okay. Do you use like a pill box at home?
Yes, but
Okay.
now I'll just make sure he's taking them and making sure he's not sneaking a drink afterwards, because that shouldn't mix.
Okay.
Right, Dad?
That's what I hear.
And with AFib and being on Coumadin and warfarin, alcohol is something that can cause problems and variations, and so we want to make sure we have that pretty well managed too. So that would be another reason why it'd be good to talk with somebody about drinking.
Okay.
That's a good point. Thank you.
And with being on blood pressure medications, patients tend to get really dizzy with those. So when you're going from laying to standing, just take it slow, sit for a minute, and then get up, and that would decrease the risk of further falls.
That's a good idea. You can do that, Dad.
Yes.
And do you use a walker at home?
I have a cane,
A cane?
just to balance.
Okay.
Do you
Is-
think that's enough for you?
Well, so far it's worked out.
Okay.
I do have a walker too.
Okay.
Okay. And did he seem, before this fall, did it seem like you noticed that he was getting around okay with the cane, or?
It was just more the confusion and forgetfulness, especially smoking. That's a big concern. He can hurt himself while we're gone.
Yeah. So another thing that might be good is to go through and kind of safety proof the house.
Okay.
So things like you want to make sure the house isn't dimly lit. There's not like throw rugs that could, be a potential fall hazard.
Okay. Get rid of them.
Yeah, and just like furniture that might be something that he could run into that could cause a fall. Like if that table maybe is in a strange place, that just to kind of make sure that you cut down on those kinds of things and that it's easy
Okay.
to get around the house. Do you have stairs that you use in the house?
He doesn't. Tom and I live in a 2-story, but Tom renovated his office into a bedroom. For
Oh,
him, so
great. So
he's on
that's
the first
that's
floor.
nice too. So it sounds like you have a follow-up appointment with the neurologist in a week.
Okay.
So we
I
can
can
kind of
take it
set
then.
that up for you, depending on your schedule.
That'd be great. Afternoon's better, but whenever. I'll make sure he gets there.
Okay. Anything else?
I think what's important is that we get someone in the home, especially to help with the medications, because he's on some important heart medications, and I don't want him to miss any doses. So once we get that figured out, we will get someone to make sure Mr. Whitehorse is home safe and sound.
And how
There's a
about
lot that was said today. How am I going to remember all this? Am I going to get
after we get your appointment set up and then we talk with insurance and see about that home health care assessment,
Mm-hmm.
we'll bring paperwork to you that will
Okay,
have
thank
an
you.
outline of all of that. It'll also have the list of medications, when to take it, and have that everything broken down. So we'll present that to you,
Okay.
and there'll be more time for questions then too, definitely, because I'm sure questions pop up during that time. So
That'd be excellent. Thank you.
yeah, any other questions right now?
Dad, any questions?
I don't have any.
How's
Okay.
nutrition at home? Do you feel like you're getting enough to eat and you're eating a pretty healthy diet?
Well, I don't eat too much anymore, but
Okay.
maybe cereal and fruit.
Okay.
That's
So,
about it.
so that might be something we want to talk about too, is trying to set up kind of a more regimented diet to make sure he's getting all that he
Okay.
needs too.
Okay, so your simulation can be done. This is Ernie Burples, so this is Tom's dad. So we can all give him a round of applause. And Dawn Sankey, she is your actually clinical coordinator, and she played the role of his daughter. So thank you very much both. So we're gonna go upstairs up to room either 150 or